Hi, this is Jay.
And I'm David.
We are from LifeRx Wellness, and today we're going to show you a couple shoulder tests. You guys ask a lot of questions about the shoulders, shoulder exercise, but how to figure out what's wrong with your shoulder in the beginning. And one big tip before we start doing these tests: if you do feel pain, it means something wrong with the shoulder, and don't wait to the last moment. Don't try to drug yourself. Put this, pain relief pills, and just ignore this pain because it's going to become worse. That means something not functioning, something not work. Your body talk to you and send you the messages. And now we going to do tests. You have something to add, David, or are we good to go?
Yes. What makes LifeRx unique is the special testing for each of the specific muscle groups, one at a time, to determine what is going on exactly.
Okay. And the first test is a simple test. You're going to sit down, and all you need to do, David, going to repeat that. You're going to just place your hands on the side and try to raise them up and see if you've experienced any pain in all different angles. You can do that. So there we go. Yeah. So go upper 120 degrees on the side, not on the front, on the side. So you always do on the side. If you do feel pain in here, right in the shoulder, you do feel impingement, shoulder impingement. And this is something you need to address right away. You need to do physical therapy and, of course, manual therapy. How do you feel? Any pain? You feel something?
No pain, just all range of motion.
Okay.
Problem. It stops right here.
Yeah, sometimes mobility problem or restrictions, it's kind of problems too. You need to find out why. Most of the time, it's you need to look in the neck and the thoracic mobility also. Okay, the next test, you're gonna place your hands on the side of your body, grab one arm, like lock at your elbow, and you try to raise your elbow up and resist with your arm, and do other one. So basically what you do, you try to lift this way and resist. Do you feel any pain?
No.
Okay. Yeah, if you do feel pain in this situation, you have a maybe joint problem, and this is really serious stuff. If this is pain presence, you need to go to do MRI, X-ray, sound therapy, sound test. So make sure you not ignore this pain. So right in here. The next test, you're gonna place your arm on the shoulder like this, and without lifting your palm from your shoulder, you have to lift your elbow up as far as possible. You feel pain? You see how restricted David is? Do you feel pain?
No pain.
Let's be just honest, okay?
Mobility.
All right, perfect. So if you do feel pain during this exercise, it could be the shoulder impingement problems. Also, we have a joint up here between our clavicle and acromial process in the scapula. This is little joints up here. Sometimes this joint is jammed, and that's pain. All right. The next one, you're gonna place your hands on the chest, like right in here, and you have to push this towards your chest. Yes. If you feel pain in here, it's also a clavicle acromial joint problem. Do you feel it? No?
No pain.
Good. The next one, it's a test. So you can do this at home without anyone. And just like I said, if you feel pain, call doctor, call us, call physical therapy, and do it right away. Next one, you're going to place your hands on your stomach like this. And what you're doing, you start rotate inside right in here. So inside, How do you feel it? You see, Try to go more. We have mobility problems. Do you feel any pain?
No.
All right, here we go.
A lot of mobility problems.
A lot of mobility problems. So this is kind of simple test for you guys. If you experience pain, you're pushing up here and you feel pain. It's also can be shoulder impingement and acromioclavicular joint problem. The next test, it's not a test. It's if you guys feel the numbness in these two fingers, not in 4 fingers, not in 5, just in these 2 fingers, in your pinky and what's this? This is the ring finger. Yes. If you do feel pain, numbness or tingling sometimes, or it's like a burning sensation, it could be your neck problem. It's not the shoulder problem. Also, the numbness in these 3 fingers, right in here. 3 fingers. 2 fingers. So in these 3 fingers, it could be different nerve. The nerve is being jammed, and it could be in your cervical. It could be in between your first rib and clavicle bone, and also like problem in the elbow. So numbness, not good. Could be the neck, could be jammed your brachial plexus nerve. Okay, and if you do feel this discomfort, you need to call doctor right away.
Now, if it's the 4th and 5th finger, it's the ulnar nerve. And so there's a pathway to that nerve. So it can get entrapped anywhere from your neck all the way down. And so we have to take a look at where that could be. Also, if it's your your thumb, 2nd, and 3rd finger, that's your median nerve. Sometimes it's your carpal tunnel. But a lot of times it's not coming from the wrist, it's coming from somewhere along the line, starting from your neck. And so we analyze and figure out where is it being entrapped.
Yeah, so I'm not trying to go that deep and explain. We got so many video about this nerve flossing, medial nerve, radial nerve, ulnar nerve. The problem is if you guys experience too much pain in the shoulder and that's become chronic pain, it's not good. So you have to make some action, do some first step to heal yourself, to feel better. So make sure you don't experience pain for a long period of time. You don't want to create this chronic pain. One more thing, if you feel like this is crunching when you do some exercise, when you lift some weights and you feel like crunchy, it could be a little bit arthritis. Also, you need to see the doctor, do MRI, and see how bad this arthritis is. If this is the popping, people ask what I'm doing, some movements, it's pop. Usually it's your old injury, maybe some scar tissue, and of course, unbalanced shoulder. That's mean the humeral bone inside that socket, it's not stayed properly, and that's make that sound. You have to be balanced with specific exercise, with manual therapy. So what we learned today, if you do those tests and you experience pain, you need to do action right away. Don't wait. Pain it's just a signal to your brain, signal for your body, it's something wrong. Okay, and you have to, of course, try to help yourself, try to fix this problem. I mean, fix is a bad word, but I'm going to use that. All right, so you have a good day and stay healthy.